The law has been involved in healthcare since the Constitution Act, allowing government to have jurisdiction, the right to draft, pass, and enact laws within its region. These organizations strive to protect the health of working Canadians, maintain a safe and healthy workplace. Healthcare providers work with these organizations when helping patients regain health and mobility to return to work. They assist injured employees by providing wages, rehabilitation, and training. Each province and territory drafts and administers the legislations related to these boards. There are 14 jurisdictions, 10 provincial, 3 territorial, and 1 federal. Federal government manages labor affairs for certain sectors, employees of the federal government, and of federal corporations. Each province and territory has an occupational health and safety agency that enforces its own body of law. Ensures a safe environment, sets guidelines with legal enforcement, and outlines the rights of employees. The right to be aware of potential safety and health hazards, take part in activities aimed at preventing occupational accidents and diseases, and refusal to engage in dangerous work without jeopardizing his or her job. Established by the Federal Hazardous Products Act and the Controlled Products Regulation, all bodies of government enforce this legislation. Applies to all Canadian workplaces whereby hazardous materials are used, such as in hospitals. Includes a different category of drugs referred to as schedules. The properties of drugs and their potential harm are identified. For example, Schedule 1 includes cocaine, heroin, opium, oxycodone, morphine, and codeine, where Schedule 2 drugs addresses cannabis. Indicates who can prescribe controlled drugs, such as doctors and dentists, and conditions and terms of use for prescription narcotics. Are closely monitored, prescribed by a physician and carefully dispensed by the pharmacy. Most facilities have these drugs stored under double lock at all times. RNs used to be the only ones who could handle and dispense controlled drugs in acute care settings. However, now registered practical nurses and licensed practical nurses have this responsibility. It is illegal to prescribe or administer narcotics except for legal therapeutic purposes. As a healthcare provider, you want to be aware of any individual who presents with drug-seeking behavior. This is behavior or activity focused on obtaining access to addictive controlled substances. When drug abuse is suspected, the patient should be treated with another drug, or if an individual is suspected of selling the drugs, they should be reported to the police. Prescribing practitioners must keep detailed records of controlled substances prescribed and provide authorized inspectors with access to these records. Medical marijuana via prescription for medicinal purposes. Physicians must fill out a form similar to a prescription for patients requiring the drug. This newer system better controls the quality of the marijuana produced and its distribution. Herbal incense, when inhaled, provides similar high to marijuana. Drug effects include hallucinations, psychotic episodes, and seizures. This category is in a gray area in terms of legality. However, Health Canada considers any product that causes the same effects as marijuana illegal. Strictly controlled and must meet certain criteria. Commercial advertisements, for example, merely hint at the drug's intended use and end by suggesting that viewers ask their doctor. Federal government retains the power to enact laws to manage health-related emergencies of national concern, such as 2003 SARS epidemic, West Nile virus, and avian influenza. Federal government is to renew the outdated Quarantine Act, giving the government power to assess individuals and detain those who may possess a health risk to Canadians. Allowing Canadian authorities to respond more rapidly to health threats at Canadian borders and better prepare authorities to deal with threats and risks to global public health. However, it does not restrict the movement of Canadians from one province or territory to another. Divert aircraft or cruise ships to alternative landing or docking sites, designate quarantine facilities anywhere in Canada, and restrict or even prohibit travelers who represent a serious public health risk from entering Canada.
Created using Powtoon.